The what ifs of enteral tube care. What if my child's NG or G or GJ tube gets clogged? Draw up a small amount of warm water using a 10 ml syringe. Clamp the tube and attach the syringe. Unclamp the tube and gently try to flush the warm water in by using slow, easy pushing. Do not force the water in fast or hard as the tube can become damaged. Clamp the tube once the tube becomes unclogged and restart feedings. If the tube is unable to be cleared, call the clinic and notify them. If it is after business hours, bring your child to the emergency room as soon as possible if they will miss feedings or medications. What if my child is getting feeds and starts vomiting? If your child is vomiting, you may stop the feeding for 1 hour and then attempt to restart the feeding. If your child continues to vomit, call the clinic and notify them. If after business hours, bring your child to the emergency room as soon as possible to make sure they don't miss a large amount of their feeding. What if my child's feeding tube comes out? If your child's G tube comes out, you can replace it as taught. If your child's NG tube or GJ tube comes out, call the clinic and notify them. If after business hours, bring your child to the emergency room as soon as possible to have the tube replaced. What if I run out of my child's formula?
Be sure to stay on top of your formula supply at home to prevent running out. If you are running low on formula, call your home care company to have more delivered as soon as possible. Give at least 2 to 3 days before running out. Do not wait until the last day of your supply. If you run out of formula, call clinic and notify them. Then bring your child to the ER to receive their feedings until you can have more formula delivered. What if my child has the Ifs of Enteral device? If you have a newer feeding tube that has an Ifs connection, you will need to use Ifs syringes. If you received older oral syringes, you would need an adapter, such as the one below, for the syringes to lock into the Ifs device. It is better instead to request Ifs syringes than to use older syringes with the adapter. What if my child has an older enteral device, not Ifs, but we are only given Ifs syringes? If your child has an older style tube without the Ifs, but you have received Ifs oral syringes, you will need an adapter, such as the one below, to be able to use the syringes.